Public safety. We're gonna switch, we're gonna put Caitlin up first from, about the health department building, so she can have as much time as she needs. Come on up, ma'am.
Hang on, need a motion to approve
Oh, sorry.
July 21st, 2020 minutes.
So moved.
Thank you. All in favor?
Aye. There you go. Now you got it.
I'm getting short. I only got 2 more meetings.
I'm trying, you trying to rush through it.
I am. Come on up, ma'am. Sorry
All right.
about that.
I'd also like to introduce Marvina Jones. She is new to us. I think some of you, I know she's talked with you, Amanda.
Yes.
But this is Marvina. She's our rural health program manager, and she's doing a lot of the administrative work related to launching the clinic at Walhalla. You want to say something?
I'm just happy,
Come on up. All means. Y'all are important.
just happy to be here, happy to be part of the team, and I want to get to work in the Walhalla community, so
Yep.
thank you.
So anybody you know in the community that Marvina needs to know, please feel free to reach out to her and to me. So again, my name is Caitlin Kickham now. I just got married, so I'm getting used to saying that. So Caitlin Kickham. I'm the Director of Outreach and Wellness, and I'd just like to thank everybody that's here and on this call for everything you've done getting that building together. It looks so good. We really appreciate it. Where we're at right now is we are still seeing patients on Friday afternoons in the clinic, telehealth in the morning. We have had the ready rooms installed, so new exam beds. We have to get some plumbing done to get our sinks installed. But as soon as that's done, the rooms are gonna look brand new, everything's good there. There's a couple of logistics related to starting a clinic that I'd like to talk about just for a second. So number one, we have to get a lab license so that we can draw blood on site and do things like hemoglobins and glucose. So there's a lot of little things you have to do, and then you have to submit something to the state. So it's gonna be about 45 days before the state allows us to do that. So that's the kind of timeline we're looking at. We also need a pharmacy consultant. So in order to provide any kind of medications on site, in order to keep oxygen, in order to have immunizations on hand, we need a pharmacy consultant to allow us to do that and to oversee our stock. So this will be somebody who checks our emergency kits, makes sure that our immunizations aren't expired, and basically touches base with us once a month in the clinic. So if you know any pharmacists who you think would be interested in the community, please connect me with them, because I'd love to talk with somebody local to the community that knows what we're doing in Walhalla and could help oversee that. So the point of today and us coming is to talk about the second floor of the building. As you know, there's some things being stored up there right now. We're gonna start out on the first floor, but this center is gonna be not only to take care of all of the patients in Walhalla, but to also do research so that people that live around here can have access to the latest and the greatest going on in research and clinical trials. We want it to be an academic hub. So as you know, Clemson's got a lot of different departments. They do a lot of things, and we want synergistic activities to go on up there. So teaching students how to be healthcare professionals, teaching students how to talk to patients, teaching students how to get involved with research, and then bringing in students that aren't just medical. So we have a department called rec therapy, for instance, and they do lots of leisure assessments with patients to get them up and moving if they've got like a knee injury or something. So engaging with those people is important for the community, for the holistic healthcare aspect of things, but we're gonna need more space. So if at all possible, we would like to begin the discussion to move into the second floor so that we can house some of these peoples and some of these additional activities. Our target for the grand reopening we want to have is gonna be probably February, maybe March, but we're going after February. We are currently getting all of our clinicians credentialed with all of the major payers from insurance, so that means we won't have to turn a patient away. I just got my notification today that my Medicaid waiver has been signed, so I can now bill Medicaid to see patients. So we're working through all of that. We're working on the VA insurance. We're working on Medicare. All the other ones that go on in our state, our nurse practitioners should be able to bill for, so that's exciting for the community. I'm a quick talker. I don't really have a whole lot else to say. Did I miss anything? If you have any questions about what we're doing or where we're going, I'm happy to answer them. Anybody?
Amanda's Craig Schumacher still living around here. He's a pharmacist. He's retired.
I don't know Mr. McCall. I don't even believe I know him at all. What's his last name?
Craig Schumacher. He's a second cousin.
I'll see what I can find out, but I don't even know that I know the name.
Ms. Oliver knows him.
Miss Linda Oliver?
Yes, ma'am.
Okay.
Excellent, thank you.
All right.
I figured y'all would know the people.
Anything that the county can do to help you, we're gonna do. This clinic for those is very important. I guess you know Jamie Myers closed his office.
Yep,
It's just that we're having a shortage of doctors.
yep,
You got 7,000 veterans and growing.
yep.
Anybody got anything else?
Real quick, Caitlin, what would be the timeline for the second floor? And that's our legal archive for a lot of stored records.
So, we would love it as soon as possible. The more that we can engage with these other departments to get those grants written, to get that research started, but we need a good hub for it, and we want Oconee County to be our hub.
Amanda, at one time, we had a question about the fire protection system for the second floor. Do we have a workaround on that, or?
Because the occupancy level is so low, they did not require sprinkling. There will be a requirement for a sprinkler system if the occupancy level on the second floor is 10% or greater of that for the permit on the first floor. So we'd probably have to sprinkle, yes, sir. Because the second floor is unoccupied right now, we don't have to do it, but any occupancy would require the sprinkling of the entire building.
Some of those records could be moved, like the coroner, he could take his record, he's got his own office now, right?
The coroner is only a 8 by 10 area. It's literally smaller than my desk.
And then we got the box room with all the empty boxes in it.
The empty boxes are for when we take records over, because we have a 3-year retention period on a lot of records. So what we do is leave the empty boxes over there. When it's time to close out a year over here, we bring all the empty boxes back so we don't have to purchase more boxes. And we rotate those boxes out.
Well,
And then some records, of course, we have to keep on file forever, permanent records.
Well, some of it could be done away with, some of them.
About a third of what's over there, we get rid of annually by throwing out the window
This is
into a
what
shred truck.
What she's doing is very important, because healthcare is gonna be.
Absolutely, absolutely.
Paramount problem. We got an aging population, we got insurance, for those that aren't covered by VA, the care is gonna get real expensive in a hurry. And they're providing a absolute needed service.
I hear you received service was it last week or week before? Did you call me and tell me you got your first flu shot?
No, I
He did, he was proud of himself, I'm proud of
but
him.
Michelle did a good job. She was good. She did a real good job. Took nerve for me to go in there though.
Yes, it did.
It's a good year for a flu shot.
Huh?
It's a good year to get a flu shot.
Yeah. But anything the county can do, or Jerry Dyer, he's got the VA behind you. So don't be scared to ask.
Okay. And like I said, so we're working on all those insurance contracts, but you just said, you know, sometimes you don't have insurance coverage, and I know that that's a big deal. So we did implement a self-pay discount. So if you think about the average nurse practitioner visit, it's about $70 usually, at our center at least. And we did a 40% discount on that. So if it's self-pay patient, it's about $43 to see a nurse practitioner. So that brings it down to a very attainable cost. And for people without any money, we have free clinic funds to cover that. So when I say we're not gonna turn anybody away, we don't wanna turn anybody away. We wanna make sure that everything is affordable, that people who are scared to come in and get their flu shots still come in and get their flu shots.
Well, and like John brought up about sprinkling, if we have to sprinkle things, look, we're serving the citizens of Oconee County.
Right.
We're not serving the tourists, the special interests, we're serving everybody
Right.
that pays taxes
Right.
to the county.
Right. And don't forget, we're gonna park one of our mobile clinics there, so for, you know, I know Oconee County is quite large, and even if something's only 10 miles away, it might take 45 minutes to get there up those mountains. So we're gonna have a mobile clinic that can get out to the people that can't get down to us.
And in closing, I would like to commend Lake Julian, the entire staff. Absolutely, great job.
Absolutely. And if anybody hasn't seen the inside, I would love to show you, just let me know,
Thank
you know, it looks so good. And again, we don't have our sinks installed yet. Once we get the sinks installed, it's gonna look fantastic, but just the work that's been done, it looks like a brand new building.
It certainly does. Anything else you want to add?
I just appreciate y'all's time and everything you've done. We're ready to get started, hit the ground running.
Okay, just keep, anything you need, keep hollering.
We will.
Thank you, ma'am.
All right, thanks for having us.
Yes, ma'am.
Thank you, Caitlin.
Thanks.
Thank you.
All right, we got one thing we want to add. We're gonna have, I asked the sheriff to come here tonight, because he wants to, come on up, Mike, about the extra deputies for more law enforcement. Is he,
We don't have anything that would come under, someone could just make a motion. to
Need a
amend the
motion
agenda.
to allow.
Second.
yeah, come on up, Mike.
All in favor?
Yeah,
Thank you.
Thank you, Mr. McCall. Good afternoon. I heard her talking about shortage of, I touched the podium, and I wasn't supposed to do that, was I? Shortage of doctors, well, I guess I want you to continue thinking about shortage of deputies. As we move forward, move into the new year and budgets and things ahead. Give you an example or two, we're having lots of businesses, faith, places of worship calling, especially around getting the holiday season, Walmart, shopping centers, wanting extra duty deputies, and we're struggling to fill them. So, the public demand for law enforcement is there. I hope we can fulfill all the requests this year, for Walmart and Belk, and, we've got a couple of churches that's wanting folks there as well, so. But we struggle sometimes filling those, so, we've talked about it before, but just the ratio of police officers to citizens in rural counties, I've shared that with you, we want to continue to try to move forward in our budgeting process, to fund additional deputies. We appreciate what you've done so far, I really do. The 8 years that I've been sheriff, you have added additional personnel. Very appreciative this year of the additional dispatcher for our 911 center to support the complaints from fire folks that we get sometimes, and sometimes they're very, or most of the time, all the time, they're justified. Those folks needed more support in our 911 center. Additional detention officer this year, we're thankful for that, and we appreciate that. Appreciate the funding as far as the salaries go. We're still below the bar where we need to be, but, just consider as we move forward, that if you need whatever justification you need or data you need, let me know, and I'll be more than happy to furnish that.
Sheriff, the growing rate of the county, the population growing rate of the county is not matching up with the ratio that you need for deputies. We got more and more population, and we're only adding just one or two deputies here and there. And you just lost one of your investigators, retired, and that's gonna leave a gap.
Yes, sir.
So, we're gonna have, the council is gonna have to address this, where's your priorities? Your priorities are always law enforcement and fire. That's your core priorities of county government. And when you need a deputy sheriff, and you don't want to have to sit there and say, well, your priority, you got a low priority because you just beat up and we got somebody being murdered down the street. Sounds kind of silly, but you got to look at the murders more important than somebody getting beat up.
Well, just the response times, and that's some
Yes, ma'am.
additional data.
That's
the
right.
Response times that we can furnish for 911 calls and crimes in progress calls. We don't want those to continue to increase, so just ask, council, I guess I'm looking at Mr. Elliott and our chairman, because I know you'll be going off, but as we go forward to the future, certainly, please consider us, and whatever data you need, I'll be glad to furnish that.
Thank you very much, Mike. All right, now we, update regarding food donations to local nonprofits and people that are starving to death in the county. David, did you find, no, I had Katie, excuse me. Katie was gonna make calls to corporate people in the grocery store.
I was gonna work with Mr. Rude.
I believe I have a little bit of information and Amanda has more information. I have reached out to local grocers, which are corporate chains or chain grocers. They do have specific legal policies as to, what foods they can dispose of and when to dispose of them and what they can or cannot give to third parties. Generally, they're legal. They say Paradigm, how they want to dispose of the stuff doesn't provide for it to go to third parties, but individual grocery stores may operate differently depending on the scenario and how they work with the nonprofits. And I think Amanda has information to pick up from there. Generally, the grocery stores don't want to do it for liability purposes, but operationally, it works out a little differently.
Yes, yes. So I did contact several local food banks, one of the largest in the county being the Golden Corner Food Bank, and they receive food donations from Walmart, Bi-Lo, Food Lion, Aldi, Walmart in Clemson, public stores in and around the Anderson, Easley, and Clemson areas, and they received to date almost 500,000 pounds of food in a one-year period. One specific grocery store, which I don't believe anybody is named, based in North Carolina, it's their corporate policy, and I think we all know that we're talking about Ingalls.
Darn right I do.
It's their corporate policy to send everything back to where their corporate headquarters are, and they make the donations locally at their corporate entity. I have another comment from another large food charitable organization that said, we don't want to bite the hand that feeds us, said they don't want to cause a stink, because as far as the local policy is concerned, they do feel like the management of the local stores is very compassionate and does distribute the food as much as they are locally able to do.
So we got everybody on board but one.
500,000 pounds in 1 year in a county this size is pretty remarkable.
It is, but
It is.
the other grocery store that we didn't name could do their,
Right, but that would be like us forcing auto parts dealers to give away their used parts. I mean, that's not a place where we can control. We can encourage and thank them for what they do and continue to show them that there is a need here. I think in this particular instance, we may draw more flies with honey.
well, we tried. Thank you.
And the second largest food bank, the one I did mention, she did say locally that, that the management here in our local division, they do what they can, but there are certain rules that do absolutely prohibit,
Yes.
like dairy, meat, and certain kinds of vegetables, but not all kinds of vegetables. And I wasn't sure why, but I also read online that like bad lettuce can make you really, really, really sick, where a bad strawberry just doesn't taste good.
Reason I'm on this is because the military, like you want, I know the Navy, Coast Guard, if you get they come in, you need stuff donated, they'll donate it. It ain't got no labels on it. It says milk class 1, but they donate all that stuff. So if the military can do it, everybody knows military food ain't the best in the world, then why can't other people do it? That's my whole point.
Right. And I think going forward, we'll continue to try to encourage that. I was really shocked to hear that we receive almost 500,000 pounds a year. I don't know why, that seems like an astronomical amount of donated food. But there are times, even with this amount of donation coming to food charity organizations, that the need to purchase food still exists.
Yeah, one thing that is kind of upsetting, you got a lot of people donating to people that really need it. And then you go down here at the local food pantry on Main Street at a certain time, and you see people, there ain't nothing wrong with them, 20 years old, pushing a stolen Ingles grocery cart down the street. They were loaded up with groceries headed back to the government housing. Ain't nothing wrong with those people. And yet in mine and now the soon-to-be Matt Durham's area, we got people that by the time they could get to the food bank, the only thing that is left is dried noodles. And that's upsetting to the people that really need it. If you can work. But we got a big population of mill workers after Avondale, other mills, they raided the retirement accounts, they got nothing. And that's the ones we gotta watch out for. Anyway, I really appreciate you going out on a limb like this.
Anytime. And I just do want to make a note too, you know, the county council for the past 6 years that we pulled up, when there are needs at our local organizations, whether it be the food bank or the Ride to Work program, you know, when agencies come in, we do as a government, which means that I hope that that is citizen helping citizen. We do contribute to the needs and the request of agencies that come in and make those requests through council.
You see, Amanda, you know, we don't even have a Red Cross here anymore.
I know.
Since Kathy died, that went out the window.
Yes, sir. We missed her and the entire Red Cross crew in the days and months following the tornado.
Yeah, and that was a big gap, because they pulled back to Anderson.
Actually, they did move to Anderson originally after she passed, and now they've gone to Greenville.
Wow, even further.
They do it as a region now. They don't have a county-by-county office anywhere that I know of.
That's a shame, because we could have really used them.
Yes, sir. We sure could have.
Okay, anything else? We got done quick, I don't believe it.
Yeah, Wayne, I want to just say that this is your last committee meeting, and I want to thank you for your dedication for 12 years of law enforcement, public safety, health and welfare of the citizens of Waconia County. Thank you.
Well, thank you, appreciate it very much. That was very nice. Scott, you want to say, you got anything you want to add?
I'm good, sir.
You don't need a fire truck or something? I mean,
You better quit that.
Yeah.
You better stay there, Scott. Just kidding.
In closing, we're getting more and more of a government presence up here in U.S. Navy. They use Joe Cassie regularly now for training. Little Creek and I think Panama City's fixing to come back up. We loaded them out last week. So they went back, but they'll be back. So that's getting us more and more on the spot. And they're talking with the chief and one of the officers. They're very civic minded, so we might could get some help out of them for different things for the county.
Thank you.
Anything else, guys?